Hi, everyone. Welcome to this conversation that we're having today. Trust in authorities, the golden ticket to successful COVID-19 vaccine rollout in conflict settings. I think it's a very fascinating title for a fascinating conversation that we're going to be having today. My name is Charline Burton. I'm the Executive Director of Search for Common Ground. We're a peacebuilding international NGO working in 30 conflict-affected countries across the world. And it's my pleasure to be co-hosting this conversation today with the European Commission. As I speak in Brussels, at the heart of Europe, today is the first anniversary of the first case of COVID infection in Belgium. And since that day, I suppose it's no surprise to anyone when I say that our world in Belgium and Europe, but across the globe, has transformed dramatically. There were 100 million people who've been infected by the virus, and 2 million people who have passed away already. Of course, pandemic is about health, but it's not only about health, right? Across the world, we're all seeing the effects of the pandemic and the ensuing lockdowns. We're getting ready as we speak for the worst economic recession since the Great Depression in the 1930s. We're seeing waves of crackdowns on social and human rights. On the rise is social unrest, and so is inequality as well. Across the world, because of COVID, the trust in governments, in politicians and policymakers has eroded. For sure, COVID is going to leave lasting scars. What we know as a fact as well is that it's in the conflict-affected areas of the world that these scars will be the deepest. It's with the conflict-affected populations and communities that COVID is going to hurt more. We know that vaccine provision and then vaccine rollout in these conflict-affected regions is going to be challenging for many reasons, because it's costly, because it's going to be a logistical challenge for sure. But the issue of trust and mistrust among citizens of fragile and divided societies is also an extra challenge that will undermine vaccine acceptance and vaccine rollout. And this is what we're here to talk about today. So I'm pleased to be facilitating this important conversation with policymakers, experts from across the public health, communication, and peace building sectors. We're going to be looking today at the causes and consequences of mistrust and how together we can work to address this. We'll hear not just from Europe, but also from different countries in Africa and the Middle East about new ways of thinking about trust and mistrust. We'll hear about foreign interferences and whether governments do take this question of trust and mistrust into consideration at all when they're planning for vaccine rollout. So I'm really pleased to welcome all of you to what will be an interactive conversation. It will not be only us speaking, but we'll be having a conversation with all of you who are listening to us, who are here with us on Zoom or watching us on Facebook Live. And so before we start and I give the floor for the opening remark, I'd like to go through a bit of technical housekeeping rules. So if you mind going to the next slide, please. We're going to be showing you some of the rules. Needless to say, if you're muted, please remain muted until the moment when we're going to be opening for a Q&A in the second part of this conversation. We're going to be monitoring your questions. There is a chat box, a conversation chat box in Zoom, and there is a comment section on Facebook if you're watching there. Feel free to add your comments in the comment on Facebook or in the question and answer in the Zoom call. We'll be monitoring them, and my colleagues are going to be conveying them to me when we're going to be opening this. You can see a few hashtag and handles if you'd like to do some tweeting and social media around this event. You're welcome to do so. So this being said, I'd like to give the floor to Hilde Hardeman, who's the Director and Head of Service of the European Commission's Service for Foreign Policy Instrument, which is the instrument that puts the EU foreign policy into action. It's implementing the European Commission's political priorities in a flexible and first responder tool that focuses on conflict prevention and peace. And this conversation that we're having today is part of a program that's funded by this instrument, which is meant to enable conflict-sensitive response to COVID. So Hilde Hardeman, the floor is yours. Thank you.
Thank you very much, Charline. Good afternoon, good morning, good evening. A warm welcome to all who participate wherever you are. And of course, my thanks to Search for Common Ground for all organizing this timely event as part of our cooperation, as Charline already said, on COVID-19 response in conflict and crisis settings. And my thanks also to all panelists. We have a great panel together. This pandemic that we are all going through is affecting the lives of billions of people around the globe, and so is the socio-economic crisis that accompanies it in many places. In Europe, we have put in place the biggest recovery plan ever. We are fortunate enough to count on existing and new social safety nets, and still the situation remains difficult for many. And of course, in conflict-affected contexts around the world, the situation is even much more difficult. As the Commission Service for Foreign Policy Instruments, we have focused our response to COVID in conflict-affected settings on three strands. Firstly, supporting the appeal of the United Nations Secretary General for a global ceasefire amid COVID-19. Secondly, providing support to hard-to-reach populations in conflict-affected contexts. And thirdly, and very importantly, providing access to reliable, factual information on the pandemic and everything that goes together with it, including the vaccine, in areas where this information is used to fuel discrimination and hate speech and to exacerbate conflict. So our discussion today tackles the disinformation aspect. Indeed, we all know that the wave of disinformation is further aggravating the COVID situation. As COVID-19 spread quickly, Charline referred to the first case in Belgium a year ago, we know where we are today, we saw a parallel rise in disinformation around the pandemic, spreading fast thanks to the ever-increasing social media penetration in societies across the globe. There are rumors and misinformation, but there is also deliberate disinformation and political propaganda, to such an extent that the World Health Organization has termed this trend an infodemic. Clearly, disinformation hampers effective public health responses and thereby causes loss of life. It costs people's lives. It also unsettles individuals, relationships, societies. It increases the risks of stigmatization and conflict. And while we all know that disinformation is obviously as old as mankind, the magnitude and global scope of this infodemic today, with all the means that exist today, seems really unprecedented. And that is why, as the European Commission's first responded to risks of conflict or crisis, we have put forward a package of actions to help address the challenge of disinformation. And we do so through our partnership with Search for Common Ground and others in Africa, the Middle East, Latin America, and in Asia. What do? We provide support to local independent media, to fact checkers, to initiatives to create space for dialogue and collaboration among actors that work to counter disinformation. And in doing so, we make use of every opportunity to tackle sensitive issues within conflict-affected societies and to create and make use of opportunities to build hope, trust, and peace. The list of achievements so far is, I think, impressive. The trainings that you have provided to journalists, the awareness raising campaigns, the research, the radio programs you have produced and broadcasted, and of course, this global platform Connect Us that we are launching today. The work you and others are undertaking on the ground is crucial, even more so at a time when we see new peaks of infection and when the crisis is hitting fragile economies hard. We all know that hope, trust, and peace are really crucial for a successful vaccine rollout and for effective recovery. So let me thank again Common Ground, the Search for Common Ground, for organizing this event and all of you for taking part. I look forward to our exchanges today and, even more importantly, to the next steps we can take to ensure that our collective response to the COVID-19 pandemic is effective and conclusive and contributes to building hope, trust, and peace. Together, we really can make a difference. Thank you so much.
Thank you so much for your introduction remark, Hilde Hardeman. It's a pleasure to be having that conversation. So now we're going to be starting, building on these concepts that we've talked about in the introduction. The issue of disinformation, of manipulation of information, infodemic, and also taking into consideration the specific context of conflict-affected areas. We're going to be having a conversation with 4 experts that come from different areas of lives and different backgrounds. We have Dr. Adrienne is the Director of Institutional Learning at Search for Common Ground. So the same organization I'm part of, focused on peace building. She's one of our experts today. We also have Lutz Guellner, who's head of division on strategic communication and information analysis at the European External Action Service, who's also going to be part of the conversation. Thanks for being there with us. We also have today Dr. Angus Thomson, who works with UNICEF and who is part of the hub that is, sorry, I'm looking for the exact title. I'll get to that title later. Sorry for this, but you're part of this, that is it, the demand for immunization team, so which is really relevant, obviously, for the conversation we're going to be having for UNICEF, and you're going to be talking about a new report that has been released recently. And we have also Shane Stevenson, who's the country director for Oxfam in the occupied Palestinian territory. So you see, we have a diverse group of experts who are going to be talking to us about the link between trust and vaccine rollout and what they have learned as part of the work that they're doing either in peace building, health, or in humanitarian settings. So I'd like to open first to Adrienne Lemon, so Director at the Institution Learning Team for Search for Common Ground. You're a doctor of sociology and also an expert in post-conflict reconstruction. And as Director of Learning, you're in charge of a team of 50 people around the world collecting data on conflicts. And over the past year since COVID hit, you've been leading all this research around what works and what doesn't work in responding to COVID in conflict-affected settings. And you're releasing today, I think just a few minutes or hours ago, a fascinating report that builds on your work in 6 conflict-affected countries, which is Kenya, Palestine, Tanzania, Uganda, and Yemen, where you've been exploring the evolution of trust over the course of the pandemic. And in your report, you're referring to a trust or mistrust ecosystem that's made out of 4 determinants. So I'd like you, if you don't mind, if you'd like to start by explaining us a little bit about these determinants and what this tells us about vaccine rollout and how to make this work.
Thank you, Charline, and thank you for everyone who's joined today. I'm really looking forward to this conversation. In the report, we went through an analysis of what is affecting or shaping the way that people in these different countries are relating to the experience of COVID and a pandemic. But also the response to that. So, the control measures that are being put in place and the testing and the discussion of vaccines. We came up with 4 key determinants of trust. And I want to preface by saying that these are not determinants that never existed before. They've been very much built into public health efforts around the world, almost every major health effort that you can imagine in our lifetime. But in conflict settings, they have a different level of gravity. And I think we face new and more specific challenges that require consideration. So the first is access to information. And when we look at that, we're not really just looking at whether people have access or not to the correct information, but also how people trust different information sources, who is most trusted to provide information, and then what are the divides in society. So we're not only looking at sort of the average level of understanding, but what are those particular outliers that may be not accessing information the way that a general population is. Those are really important aspects in a conflict-affected society. The second is around the ability of government to provide services. And this really does go beyond just COVID-related services in this moment. And in fact, the COVID-specific services were some of the least important that people expressed. What we really see is, food security being a huge issue, services in terms of just access generally to healthcare, and the way that populations feel they are perceived as maybe having access or deserving access to healthcare. Those are some of the really important aspects here. The third is control measures. So when we look at conflict-affected contexts, we really see that governments with limited resources often turn to the group that has the most resources, or the institution that has the most resources to provide and secure, their society, particularly when we're requiring things like lockdown or the shutting down of borders that really impact the economy and people's daily lives. And so what has happened is this turn towards security sector. That means police and military being some of the main providers. And there's an important aspect there about how that impacts trust. And then last is the socioeconomic resilience of these communities. And one of the most important things there is that we are not only talking about people who were officially employed and are now unemployed, but rather whole economies that are centered around informal employment that have been heavily impacted, but there's no clear way of responding to that because they were never formally recognized. When we are working with communities where there are a lot of young people and a group of people who's supposed to be emerging into the economic workforce, but now are not able to do so. So these are some really important considerations in the 4 trust factors that we identified.
Thank you so much. It's fascinating. And as you say, those are not necessarily new factors, but it's interesting to know that they've played out very importantly during this pandemic and this last year. So based on this, Adrienne, what would you tell to the EU and other governments? What is it that we need to do to increase trust in vaccine rollout? Do you think there is any specific category of population that we should pay attention to based on the findings from your research?
Yeah, I'm going to just talk about 2. The report actually goes into a few other things that we can consider. But there's this question of information, and I think we're going to hear a lot today about misinformation or disinformation. We need to focus that on credibility and building credibility of information sources. I think the first thing that we tend to go towards is like, let's fight all the rumors. But rumors are there's like an endless source of where rumors can come from and how they can spread. The question about creating credibility is a different one. So, and that is not always, it's not the same as just combating all of these rumors individually, but rather building the credibility of key sources of information, government, or potentially local actors who may have other types of credibility. And what we see in the research is that oftentimes it's not only the official sources that we need to be paying attention to, but actually a more diverse set of actors. And the second point that I would drive home is really diversifying our response. So when we have a really centered government response, we're seeing that there's a lot of pressure on that government response to maintain credibility rather than diversifying, the sources of information, the responders that are available, and the ways that people can engage in supporting their communities. Many of the regions that had higher levels of trust in the process were actually not only using government resources, but also reaching out to local civil society, local actors, and a diverse group of actors, right? So religiously diverse, young people, and some of the more professional government capacities, but being able to work together. So those are the 2 that I would kind of drive home for now. And Search's work currently is very much focused on this media aspect and driving credibility and looking at who has credibility within communities. And then also creating, trying to connect those people who own that credibility already on a broader scale. So that's where we've created a global platform, Connexus, for encouraging that conversation, not just within countries, but actually globally, so that we can begin to learn what's influencing that credibility, what's allowing people to maintain that, and what's allowing for a better response overall.
Thank you. And that platform, do you want to say a word about it? What's the name?
Sure. Connexus is the name of the platform. We will have, I think you'll share a link, but it's cnxus.org. And it's really an exciting space. I think what's interesting for me about it is that it will include a much more diverse set of actors than we normally think of when we think of sort of public health response, and encourage a conversation that's much broader than simply a government response or a donor-led response, which is important, but I think we need to be engaging with a more diverse group to be successful.
Thank you very much, Adrienne. And I'd like to move a little bit away from Africa, where most of your research has happened, to going to the European neighborhoods. And with Lutz Guellner, you're the head of Division of Strategic Communication and Information Analysis at the European External Action Service, also known as EEAS. And you lead a team of people dealing with issues related to disinformation and foreign interferences. And you have a particular focus, I understand, on addressing disinformation threats for the EU and the neighborhood, which is the Eastern neighborhood, the Western Balkans, and the Middle East and North Africa region. But you're also looking at specific actors, not least Russia and China. So I'd like to understand, has COVID changed anything in your understanding and in your experience with regards to foreign interference practices? Has this been like some kind of golden opportunity to build on the citizens' fears or dissatisfaction, to spread distrust in conflict-affected countries, governments in this neighborhood of Europe? And if so, how does that work?
Well, thank you, Charline, and thank you for having me. It is actually not only Europe's neighborhood, it's also the EU. It's worldwide, because we see very, very similar kind of mechanisms here. And let's go back a little bit to the starting point that was mentioned already by Adrienne and Hilde in her introductory comments. Trust has always to do a little bit with the information that you get, because that is the basis for your opinion, but not only public information. It's always this mix of what you hear via friends and public sources, etc. And you see already where I'm getting at. We have very, very different sources of information, and that brings together, let's say, all these opinions or the attitudes then that form. So we need to look broader than just the media in any case. But coming to your question, yes, COVID was really a watershed moment for us, because we have seen, especially in the beginning of COVID, we have seen, Hilde, I think, mentioned this already, we have seen an infodemic, really an explosion of all sorts and forms of let's say, misrepresentations, of misperceptions, of outright lies, of conspiracy narratives, all sorts of things. And it was actually quite difficult to put a bit of an order in this, to understand what's going on there. And of course, it's not only one element that we can kind of find out there, but our analysis was that this was the opportunity, for basically three different strands, let's say, three different categories of things that we have seen. So the first one is misinformation. People understand something a little bit different, or friends tell it a bit in a different way, so people get the wrong impression. That can be quite harmful, but there's a big difference. This misinformation has never been produced to mislead anybody. There's no intention behind it. It is harmful. It needs to be addressed. and it needs to be rectified because it can have an impact, but it is not malign, let's call it like this. Then we have seen a second category of very deliberately placed disinformation, either for political reasons or also for commercial reasons. Let's not kind of brush this aside. A lot of the things have to do with clickbait, have to do with that you can make money with disinformation. And a third category, and that is what my team is mainly looking at, is let's say also the external dimension, so a bit of security dimension, that certain actors, either state or non-state actors, are using this opportunity of confusion, of polarization, and tap into it. And that we have really seen kind of quite in explosion in the COVID times. It keeps on changing in form and shape. Even the actors sometimes change, but it has become a serious issue. And maybe what is really important for us is always to underline, this is an issue that not the governments alone can solve. This is not an issue that you can solve by decree or by law, etc. But you really need a multitude, a multifaceted approach. I'm sure we get into some of these elements in media, in digital kind of rules, in foreign policy elements, in education policies, and you need to think all these elements together. I think this is really crucial.
Yeah, thank you. And so that's really useful to understand the difference between misinformation and disinformation, because I'm not sure everyone really understands this. So it was a clear distinction made. Thank you for this. So my question is, what can we do about it? Because as you say, it is not, you cannot rule this by decree, by law. It's also about information that doesn't only come by through the media, but your friends. And this is something that's really hard to control. So what are you suggesting we could do about it? And if you have any mechanisms that you would recommend that we put together, or lessons you've learned, and maybe also specifically the role of social media platform in all of this.
Yeah, I think Adrienne already put the finger on a couple of those elements, so I will not repeat everything, but more build on it. I think we need to distinguish two elements here. There is an element of, let's say, upstream, where the disinformation is produced, where it's kind of pushed out. And there's an element of downstream, if you want, those that are the addressees, And we need very different tools to address the one and the other. Adrienne spoke already a little bit of the downstream. So how can we build resilience? How can we help our citizens, the people who are kind of navigating on social media platforms, or how consuming the news, kind of how can we help them, in terms of guaranteeing better quality, and I come to a couple of these ideas. But let me start with the upstream for a second, and that is, we see that disinformation is deliberately and intentionally produced also for the reasons that I just mentioned. And I think there it is a very, very important element also for governments to look a little bit closer. So what are these mechanisms? Where do they come from? How can we curb this? Not to identify what is good and what is bad, and what we like and what we don't like, but what is the practice of those who produce information, to guarantee or to, let's say, develop a sort of protection from intentional manipulation. I think this is really what we are looking at. And we can look to the outside, to external actors, and also to the inside. And I try to summarize it because we want to discuss this, of course, but I would put it in 5 kind of words. The first one is, we really need to understand and to analyze what's going on, because I think even here on this panel, while we're speaking, things are changing, disinformation is moving to different places, to different platforms, to different types of outlets, etc. There's not a static situation that we can look at. So this analysis, this showing what we know, what we see is super important. Second point is a given, but it needs to be mentioned, is we need to connect the dots. We need to connect the work between the governments, but also the governments with the civil society, with the researchers. This is really a crucial point, because this is nothing else that can be developed kind of at government level only. And then I think a key thing, and let me say a few words about this, is transparency. Adrienne talked a little bit about this. She talked about confidence. I would call it trustworthiness, I think is the better word here. Trustworthiness in terms of how can I establish kind of a mechanism, maybe not in our public discourse, but at least in those areas where information is being multiplied, is being disseminated, you know. And of course, I'm looking now at social media platforms that play a crucial role. They don't play the only role, but they play a very, very important role. And I think what we want to achieve here is two things: transparency and accountability. Now, these are all a bit abstract concepts that I tell you here, but we have very concrete kind of proposals on the one hand, and also very concrete actions already that we are doing. But in terms of transparency, let me just give you one example. The social media platform.
Lutz, I'll let you explain your example, obviously, but I just want to be cautious of time. So
absolutely, that's why I didn't want to chat on too much, but just give you this one element of, for example, Facebook and Twitter that had to, or that actually went into an obligation, more or less, you know, or at least in an agreement, you know, that they wanted to show very clearly what source comes from which, or is financed, for example, by governments. So to label much clearer and also to make sure where this information is coming from, I think these are very tangible examples of our work already. Sorry to be a little bit long.
That's really fine. Thank you. It's really interesting to hear all of this, and it'd be fascinating to see indeed these where these flows of monies are coming from. But maybe we'll talk to that later. And I'd like to move to Dr. Angus Thomson, or senior social scientists in the Demand for Humanization team at UNICEF. Dr. Thomson, UNICEF is the largest single vaccine buyer in the world. And one of UNICEF's mandate with regards to the COVID pandemic is to build demand and acceptance for vaccines all around the world. And you're trained as a biological scientist, but for the last 15 years, you've been working on understanding vaccine acceptance and hesitancy. And you've joined UNICEF's team just as the pandemic was starting last year. So UNICEF released this guide titled Vaccine Misinformation Management Guide, which I'm sure you can put the link in the chat at a later point. But in this report and in what I've read from you, you say that understanding social and behavioral elements, determinants of demand, is as important as the supply of vaccines, and that human behavior is very important to successful disease control. So I'd like to understand how we can ensure public trust in vaccination campaigns in contexts where large part of the population, maybe minority and vulnerable groups, are already having a low level of trust in their government. What is it that you've learned, and what is it that we can learn from you on this?
Thank you, Charline. Hello, everybody. What a great conversation so far. I've got a dozen things that I can bounce off already from Lutz and Adrienne. I started my career studying the behavior of viruses, and I've spent the last 15 years studying the behavior of humans. And the two are important for us to understand and address a pandemic such as we're managing now. Yes, indeed, UNICEF emphasizes the importance of working to get people to accept and even demand vaccines, because when they sit in their vials in a fridge, they're 0% effective. I've studied what underpins people's decisions to vaccinate for some while, and there is a growing body of evidence that shows that it's actually a very complex, heterogeneous mix of elements that are both psychological, social, and of course more broadly contextual. And I think, I mean, we can talk about moral values, literally some universal moral values, people's worldview, cognitive biases, etc. But for the conversation today, I want to focus on two things. The first is trust. So thank you very much for talking about trust. In terms of vaccine acceptance, we have spent 50 years telling people that the vaccines are safe and the vaccines are effective, but really behind or underpinning a vast majority of people's decisions, I suspect the evidence suggests to me that trust is the most important element. And in a sense, we've been running down the trust credit that we had earned from the days when many of these deadly and debilitating diseases that vaccines prevent were still very visible and salient. And we found ourselves at a point where we don't have that credit anymore. And beyond that, other things that erode public trust in the health systems and the governments that provide those health systems will impact people's decisions to vaccinate. So thanks for bringing up trust. I also want to talk about misinformation because that's our topic. And so I've been focused on misinformation. The guide that I've just put in the chat is our attempt to provide a very operational guidance for countries to start to develop misinformation management strategies that address specifically vaccine misinformation. It's an element of, it's one of the challenges that we have as we look ahead to COVID-19 vaccine rollout. Let's not forget that COVID-19 has had a huge impact on routine immunization programs, on immunization campaigns around the world. A study from UNICEF and partners in the middle of last year identified that I think it was over 80% of countries were seeing significant disruption to their routine immunization services, and that some of that disruption was not due to people refusing vaccines, but due to the disruption to services, and importantly, the uncertainty and anxiety and this general context that arose within the pandemic, that I think many of the people that those of us on the call here today spend a lot of time thinking about, live with all the time. Now we're seeing a generalized level of uncertainty and anxiety around the world. Why is that important? That's important because these are the things that give misinformation traction in people's minds. So misinformation likes mistrust. It looks for mistrust, and I'm sure, I see Lutz smiling, when it's disinformation, it deliberately generates mistrust because it knows that that is going to give it traction in people's minds. Did you want to ask something?
No, it's fascinating. And also how you're saying that, it's kind of a vicious cycle, because you say because of COVID, we're unable to do routine vaccination. But from referring back to what Adrienne was saying earlier, she was also saying that whether we're able to provide quality services and basic services, just like routine vaccination to the people, would also influence level of trust. So it seems like it's a vicious cycle. What I'd like to know is whether there's any learning that UNICEF has gotten from the work in vaccine rollout across the world, and including in conflict-affected areas. And I'm wondering if we want to focus on the topic of the conversation today, is whether we have any specific lessons on how to build that trust and work on issues of misinformation in conflict-affected areas. Is it something that UNICEF has been taking into consideration? And if so, what are some of the lessons that we can learn for COVID-19 vaccine rollout? So
I think, Charline, there are lessons from the field, and there are lessons from the laboratory, and both of them are very valid at the moment. And actually, I might start with the lessons from the laboratory, because I think they continue the train of thought that Lutz started. In the guide that I've shared, I refer to an increasing body of evidence that suggests that we can vaccinate people against misinformation, or more importantly, as Lutz pointed out, disinformation. So disinformation is created with malicious intent, and it employs in its dissemination deceitful tactics. And this is important because this is actually the key to the solution. We now know that we are able to either pre-bunk or debunk, so generate a general level of immunity to disinformation in people, to general misinformation, or we can actually immunize people against specific misinformation narratives. And we do that through an approach that is being increasingly supported by the evidence, which for me pivots on a universal human value that is something that I've devised and I haven't found in the literature at all, but I do need to come up with a clever name for it. But it's the fact, I think, that there's probably no one in the world who likes to feel like they've been tricked or fooled, or that the wool's been pulled over their eyes. So we take a careful approach to not amplifying the misinformation. But a key part of this, and I won't go into detail, there's a lot in the guide there. A key part of this is
I'm already
highlighting
watching the time.
the tactics or the intentions of that. And by doing that, we're able to provide people with a kind of a trigger, a flag that allows them to potentially identify and resist the impact of that misinformation, which can also be kind of unconscious.
Thank you. Yeah, really, really fascinating. And we've been working, Search for Common Ground has been working with UNICEF in helping also work on the acceptance of vaccine rollout. I remember myself working on these issues in the Congo a few years ago. So that's really interesting. I'd like to turn to our fourth expert, because I see time running. Shane Stevenson, you're the country director of Oxfam in the occupied Palestinian territories. And you've worked for Oxfam since 2013. I see in Tajikistan, Azerbaijan, in Yemen, and now in Palestine. And Oxfam has released last week a very interesting report that's called the Inequality Virus. And so I'd like to hear from you a little bit about the issues of inequalities, specifically in the place where you work in Palestine. What is it that we can see in terms of the link between the virus and how vaccination efforts are going on, and the issues pertaining to conflicts over there? Do you see that there are risks for the future, and is there any recommendation that you have to make sure vaccination efforts over there are done in a conflict sensitive way?
Thank you, Charline, and thank you to everyone who's attending and participating, and to all the panelists who have spoken before me. To understand, obviously, when it comes to occupied Palestinian territory, it's highly complex, but when it comes to the vaccine, it's all based in numbers. And if I set down the context in terms of numbers, you'll understand some of the issues that we're facing here. So roughly the population under the control of Governor Israel is about 9 million. 3.3 million have had one dose. 1.9 million have had 2 doses. It's been heralded as the fastest tracked vaccine program around the world. It's been very successful in securing the Pfizer and Moderna vaccines. It's reported that the president had numerous phone calls with the CEO of Pfizer, and they paid $49 per vaccine, which I believe is one of the highest rates in the world. On top of that, they've also traded medical data. So he's taken a very aggressive approach that vaccines will be provided. Now, as we are coming, because I'm sat here in East Jerusalem right now, we're actually coming to the end of our 3rd lockdown, he says. Israel has been under lockdown more than any other country, and we're just coming to the end of our 3rd wave. So it's been a difficult time, but there's also the politics behind it as well. The Israeli elections are in March, and the economy, like all economies around the world, have been severely impacted. However, the economy of Israel is very much entwined with Palestine and with the workers that come across from the Palestinian territory. So there's 100,000 to 140,000 workers come across and work inside Israel and keep the economy going. However, after a month of being the mass vaccination within Israel, in the occupied Palestinian territory, which has a population of 5 million, to date, they have secured 10,000 Russian vaccines, and they've had a tokenistic 5,000 from the government of Israel. They are also signed up as the part of the Gavi COVAX international program to support countries, and they've been told they'll get another 38,000. So while we have millions of people in Israel being vaccinated, not even the health workers are being vaccinated in Palestine. So they're at the forefront of treating the Palestinians. We have now had a few concessions, the 5,000 vaccines, Palestinians that are under detention, and also Palestinians that are working in healthcare facilities in Israel as well. So you have this massive discrepancy, and it's all shrouded in the conflict and the politics. Now, what the Palestinian Authority has a duty to provide, and then it became all very political and also legal, because we have here the Oslo Accords that say that the Palestinian Authority has responsibility. But also we have the Fourth Geneva Convention saying as an occupying power that they have a responsibility. And there were some very strong statements from the UN that came out and saying that Israel still has a responsibility. We haven't even got onto the health infrastructure. Health infrastructure in the West Bank is very weak. And then we have the situation in Gaza where we have 2 million people blockaded in, very weak infrastructure, but also under Hamas de facto authority. So we have the Palestinian Authority, we have Hamas, we have the government of Israel, and we also have the international politics that goes around this. And what's happened is that we have this massive disparity and inequality, where we have Palestinians who are living literally in villages right next to Israelis who are living in the settlements in the West Bank who have not been vaccinated, and there 200 meters away there's a whole settlement that's been vaccinated. Now, how this inequality, this discrimination is going to play out. At the moment, it feels like a false calm. It feels like if vaccines don't start coming, and there has been a lot of political pressure, there has been a lot of private advocacy on this issue. But let's say the West Bank get it, and then it's not distributed fairly into Gaza. Maybe that's due to authorities, maybe it's due to infrastructure, maybe that's due to the blockade and different like this. You're going to get disparities and discrimination. And what we find is when that discrimination in this context gets worse and worse, then we move towards increasing the level of conflict. So when we get these rocket balloons coming out of Gaza, is when the situation in Gaza gets to a point that they need someone to do something. And then what happens is that Israel will retaliate. And we have this backwards and forwards. Now, if we come in with the economy in Gaza absolutely decimated by this, you know, and Gaza was already declared by the UN as unlivable by 2020, you can just see that the pressure that's going to build and build in Gaza is just going to mean that there's going to have to be a lot of delicate negotiation for that to not spill over into something that we really don't want to see.
Thank you, Shane. It's of course really worrying to hear all that information and shocking to see the disparities and how health response can also be increasing dividing lines in conflict affected areas, and we're seeing this at play in many countries that are affected by conflict. We're seeing this also in areas where you have minorities who feel either rightly or you know only have the perception that they're not entitled to accessing the same level of health supplies and health services as others. I'm cautious of time, and it's 3:21, so we have 39 minutes left for this conversation. So I'd like to now open this, as I promised it was going to be a conversation and not only just presentation. So I first and foremost want to thank all of the panelists so far, or the participants to that conversation. And I'm going to take some of the questions that I've received. I want to encourage all of you who are watching us on Facebook Live, you can type a comment, it's being monitored and will be copied and pasted in a box sent to me. And you can also, if you're in the Zoom call, you can also add your question in the chat, in the discussion box. So I have a question here from an anonymous guest who says, thank you so much for this presentation. It would be interesting to also find out more about the specificities related to refugees and IDPs. And if you're okay with this, Adrienne, I'd like to throw that question at you, because I know that Search for Common Ground has been working in IDP and refugee camps. So can you tell us a little bit about what you've learned about trust in these already really marginalized and impoverished populations?
Sure, and I'll just say the report that we've launched this morning is it's a global report, so across the 6 countries, but we're also releasing country-specific reports. So anyone who's really more interested to dive into some of these divisions, I would definitely suggest that you check out those reports for a bit more detailed information. The best example of this is in Uganda, where we really looked at specifically the refugee populations coming in northern Uganda and then also in the west. And what's interesting about that, the idea of cooperation in the face of a pandemic, it's like, who is the we? Who are we when we think about we needing to cooperate or we needing to pull together? And refugee populations aren't necessarily considered part of that. So what we've seen is that, there were, for example, speaking of misinformation, there were examples of some refugees hearing that the government was either not going to provide them access to healthcare, or that they were considered the people who brought the disease to Uganda. So some of these types of rumors were exacerbating the experience of refugees of having sort of limited access to services already. Some of them were afraid to seek them out. They thought they would be, targeted and maybe sent back if they were, if they went to go access these types of services. So we already saw that even back in, September, October, that these kinds of, for me, it's more misinformation. I'm not actually sure that it was spread intentionally in that case, but more that this is part of the consequence of having two communities that are not always collaborating and working together, generally speaking. The other thing that I would say is this is not true everywhere. So there was actually a huge difference between refugee and host communities in Western Uganda versus Northern Uganda. And a lot of that had to do with how integrated they actually were. The areas where people were heavily integrated, they're going to the same markets, they're really quite interdependent, their economic systems are interdependent. Those were the areas where we were seeing much less of this divide versus, areas where the access to land, the access to markets was all quite separate, and therefore they were, the pandemic was actually creating even more separation, but had, in a group that was already quite separated out. So these perceptions are something we definitely want to keep paying attention to, especially as, there's talk of vaccine rollout, trying to figure out, will everybody be considered, people who should be accessing that vaccine or not, and how will they navigate those sort of dual communities?
Thank you, Adrienne. And I don't know, panelists, if you want to add anything to that question or to the next question, raise your hands. I think there is a raise hand tool, don't hesitate. So I know you want to add up something to this. I have another question from Fondation Hirondelle and Colin Cogitor, who's asking about media literacy. So Colin, if you don't mind, I'd like to ask you to unmute and ask your question. And panelists, if you want to take it, then raise your hand.
Thank you very much, Charline. My name is Colin Cogitor. I work for Fondation Hirondelle, a Swiss organization working very closely on those issues, including in Africa, but not only. And so the question I'm asking to the different panelists is how much media literacy is taking into account in your approaches to disinformation and misinformation, because that's a theme on which we are working a lot. So happy to hear your answers. Thank you.
Thank you very much. And if you don't mind, Angus, I think I'll give you that question and you have your raise. So go ahead, please.
It's a great question. And I think media literacy is definitely a piece of the puzzle, and something that we can be working on outside of pandemics as well. It's a first step. If people can't recognize misinformation, then obviously it has a greater opportunity to get traction and most importantly be spread by them, but also to influence their own decisions. So media literacy and approaches that help people to identify the characteristics of misinformation, even reminding people just to stop and think before they share. One study of Twitter last year found that 60% of all the content that was shared had never even been looked at. So people mindlessly share things, blindly share things. It's as if they were, you know, like possibly infected with the virus and coughing in a crowded room. So we can help people to flag and identify it, but we can also through, for example, games. There's a great game, Go Viral, developed by Sander van der Linden and colleagues at Cambridge University. This actually helps people to do the second piece that I was referring to start to identify the tactics that are being used to fool them. And potentially, we hope to build out in other games the motivations underpinning things. When people are able to identify those tactics, because there is actually for science denial related misinformation, we now have an interesting taxonomy of tactics, and we get people to play the game to be, when the people who play the game are the baddie trying to create the misinformation and give it traction, so they can choose from the tactics. That allows them to then potentially identify those tactics. An important point, just to finish, which I mentioned in the chat, is just identifying misinformation doesn't mean it's not going to stick. So I mean, there is a huge science behind this, and in many ways the disinformation authors are doing better than those of us who should be providing the resonant, as we've heard, credible, but also most importantly, trustworthy information to those information voids that we detect. And so that providing that ability to identify those red flags, those tactics being used, kind of gets to some of the unconscious stickiness of the misinformation.
Thank you. And yeah, I mean, nobody's immune to sharing information, you know, that may not be accurate. And I've played that game you're talking about, and I have to confess that I have at times shared as well Twitter content without reading it. And I'm now receiving the Twitter notification when you share something and they tell you, you haven't read this, are you sure you want to share this? And I think it's fascinating also how we can structurally talk about, you know, the systems that prevent people from sharing information that are either untrue or that they haven't taken the time to read. Lutz, you have your hand up. Please go ahead. And if you do not want to talk anymore, lower your hand. Angus, for instance. Thank you. Lutz, go ahead.
Good, thank you. Really building right away on what James said. I think this is extremely important. Call it media literacy, call it digital literacy. There are different words for it, but it's to make people aware what the risks are, what the manipulation techniques are also out there. And let's take this example that we just said about sharing of content that you have not even looked at. I think it was, right, I don't have the latest figures, but they were at 75 to 80% of the shares. Actually, people never looked into these articles. Actually, what really happened, I mean, let's point out also a few successes, you know. The platforms have now started to say, do you really want to share this before you have read the article? You know, that is what Twitter is doing now. I don't want to praise the platforms for having done all their job already. There's still a long way to go. But I think these are the elements that we need to get into this, into the ecosystem, let's say. So on the one hand, kind of reflexes of the consumers, if I can call it like this. And on the other hand, also kind of mechanisms of dissemination. And maybe just one thing I kind of always try to point out to make it a little bit more tangible and plastic, you know, how can you, or kind of tangible and concrete, how you can relate to that. I find the work against disinformation, misinformation is very much like consumer protection. You will always have people who want to buy bad stuff, you know, who want to buy junk food. And we cannot prevent them from that, and they will always find it. But I think we need to find mechanisms that allows kind of to protect people from being misled, from being kind of pushed into something where they don't want to be. As much as we don't want this to happen in the supermarket, we also don't want this to happen in the online space. I think this is the analogy we should use a little bit. Thank you.
Thank you very much. Very, very interesting. And I see many questions coming my way. I have trying to follow everything in the chat and be listening actively at the same time. I see questions that are addressed to the European Union. So I don't know if Hilde or, because it's more about external action, So I see her with the strong refocus on donors, on COVID response, there is a risk of affecting the sustainability of local partners that are not doing COVID response, but do have a role nevertheless. Do you see, Hilde Hardeman, that there is a way, or it's the approach of the European Union to be building on local partners and building their capacities, and how can we use them even though they're not necessarily specifically focused on health response?
Thank you very much, Charline, and thank you for the question, for the very interesting debate. Well, obviously, COVID has necessarily been a focus of the work that we do with many local actors, but that has been a focus in addition to our traditional focus on conflict prevention, crisis management, mediation, peace. And it's always in that wider context that we have been working with local actors. But you cannot work on these key topics if you do not take into account everything that is related to the pandemic. If you are asking more widely about what the European Union does with different actors more generally, of course, we have worked on specific health programs and focused in our cooperation with those local actors on health. But I would like to underline that attention for COVID-related issues has become a sort of necessary and unavoidable top-up of, and sometimes the main focus of what we have been doing over the past year. So I would not share really the concern that I hear in the question that was asked. If COVID and related issues are hopefully going down again, the importance of these topics will also automatically decrease again in the different actions that we do. And today it is, in our understanding, unavoidable. You cannot act as though COVID is not there, given that it affects the lives of all of us, also your, also mine. There's no way around it. Thank you so much.
Thank you very much. And I have clarity. It was a question from Malik in Lebanon that's asked on this Connexus platform. And this platform as well, which is a platform that puts together people from, around different sectors, including health, development, humanitarian actors, and peace builders, is also one of the ways of ensuring that we share our learning and build on each other's resources. And I think it was Angus saying earlier today that it's not just about the information that comes from the media, but that's also about the information, or maybe it was Lutz, the information that's coming from your friends, from people you know, and how there is a link between who is the messenger and whether you will be trusting the information. So I think that also there is a lot of lessons learned as well on how to build on trusted, respected civil society organizations in the conflict affected areas in order to ensure around health is perceived positively. So I see that we have Cindy Chungong from International Alert. You've had your hand up for a little while, so why don't you unmute and go ahead and ask your question.
Thanks, Charlene, and thank you to all the presenters for a really fascinating discussion. I wanted to know, for Search for Common Ground, on the data that you've been collecting, whether you have data around credibility and trust of the people in this group, so that's INGOs, foreign governments, policymakers, etc. And just to contextualize, because anecdotally in some of the countries we're working in Africa, particularly in Northeast Nigeria and DRC, there's been a lot of rumors that COVID isn't real or is being exaggerated or being brought in by NGOs and foreign actors to generate more funding for themselves. And this is taken as part of a larger context where there's a general sense of fatigue around the aid sector. All these NGOs are there, all these donors are there, and yet people are not necessarily seeing huge material changes in their circumstances, but also historical legacies of colonialism and exploitation. Many people just will not trust information or vaccines coming from, European countries or Americans because, they remember that they've not always had good intentions. And then also a hardening of these nationalist and authoritarian discourses. We're seeing more governments that are turning inwards and sort of resistant to anything around perceived external interference. When you look at what's happening in Tanzania, Uganda, Ethiopia, you really see the sentiment that, you know, what's happening in our country is our business, and like other people should not be telling us what to do. So just wondering if you have any data or seeing any trends around decreasing trust of foreign actors and how this might also affect the potential vaccine rollout.
Thank you. Thank you, Cindy. Very, very interesting question. And I see Adrienne was nodding. I'd like to see whether, Shane, you'd like to answer from your perspective first, because I know there are a lot of NGOs as well where you work, and you've been working in other places like Yemen. So are you seeing anything with regards to this? And then if Adrienne or anyone else wants to answer, raise your hand, please.
I don't think I can really add too much to this. I mean, from our perspective, Angus talked about trust, and I mean that fundamentally runs through all of it, isn't it? Where the vaccines come from, depending on where you are in the world. If you hear something's coming from Russia, what level of trust do you see in that? If it's something coming from China, why do you see that it's coming from Europe? Or even if it's coming from America now, what level of trust? I mean, even by association. In terms of different actors. So it's interesting that the Palestinians have secured the Sputnik vaccine from Russia, but the Israelis have not. They've not even endorsed it at this point. So I think there's going to be politics that's going to be played out here, and the big farm, as we want to call them, they're also complicit in all of this as well. They're going to sell themselves based on nationality, on what they're going to do. There's over 100 vaccines that have been produced around the world right now. There's mutations of COVID, so there's going to be more and more in the marketplace. And so where that element of trust is going to come from. So if a government, whether it's in Africa or the Middle East, has a high level of trust with their population and their citizens, they're going to be able to bring that forward and push it out. If the message becomes confused, I believe, and this is not my area of expertise, I believe this is where the opportunity for disinformation comes out. And then you suddenly it gets very confused, and then what you might find is then a backtrack and say, well, actually, I don't know what's going on at all, and I don't trust anybody. Mm-hmm. And I think that's very much, a position that we have in Gaza right now. Because you imagine that the Israelis, this occupying power that blockaded them in, provide vaccines for them. What sort of stigma is that going to have? How much sort of trust is that going to have that people are going to be able to say, yes, I'm going to have that vaccine? Or it may just completely have the worst effect where nobody will go for the vaccine at all. So it's a political, it's a social, it's a civil, it's every single element of human nature that's going to come out in this. And I think what we need to know and what we need to strive towards, and it's really apparent here, Israel will not be safe until Palestinians are safe. Until that mentality comes through, their economies, their life, everything is entwined. You can't protect one part and then not protect the other. And then if you take that beyond where I am and take it to the region and then take it globally, and then when we have that panacea moment and say, well, actually, it doesn't matter how many borders we close and how much we don't export and import and where it comes from and everything, if we don't have a holistic, community-led, driven approach to that, and we'll have to build the trust from so many different places, because we've worked, going back to the previous question, we've worked with local NGOs who are on the ground, who are trusted to get the message out about COVID and the precautionary measures. We've used social media to get the message out. However, we know that social media is controlled by the authorities. So it's not even the information that's in social media that's disinformation, it's actually the medium itself that people don't trust. And if they don't trust that, then you have to look at other mechanisms. We don't want to get so focused in some areas of building trust and forget about the others.
Thank you. Thank you. And as you rightly put it, we're not safe until everyone is safe in this pandemic. So it's very interesting. I'm cautious of time. It's 3:43 and we're closing at 3:45. So I think, Angus, you had your hand up, so I'll ask you to answer in 1 minute. So you leave me 1 minute to close this session.
Sure. So we get our truths from the trustworthy. We talk about trust, but what's most important for people is trustworthiness. And we've heard of credibility and expertise, but it's the concerned element, someone who has our best interests at heart, that is really what's most important. So, you ask who should be communicating on this? Well, it should be the people who are trustworthy, and that's very different in very different countries. And it's our responsibility to understand who are the most trusted messengers. And please, let's highlight the fact that health workers are generally, consistently, some of the most trusted voices. We need to find who they are, and we need to equip them with what they need to be able to engage with communities, to hear their questions and concerns, and to answer those concerns, and potentially diffuse disinformation as well. And I'll share an interesting link for everybody that's tracking
Angus,
this over time.
Apologies, because my colleagues are telling me I'm totally mistaken. We're going up to 4, so we have 16 minutes. So you don't rush. You can answer your question. I wanted to interrupt before.
Can I have 1 more minute?
Leaving.
Can I have 1 more minute to finish my thought?
You can have 1 more minute.
So you asked what are the lessons that UNICEF's learned. So UNICEF and many partners are right down at the ground level, right, in communities. And in fact, there are lessons to be learned from work that I think UNICEF and partners are doing in unstable regions, in conflict-ridden regions, that some of the rich countries can learn from, because it's that local level engagement that provides the trusted information that helps people start to make the right decisions around vaccination, that can diffuse the misinformation. So really the lesson is that's the most fundamental thing, but it may be in some countries, and I will share this link, Charline, it's a survey that's been tracking over time a reasonable cross-section of countries who people trust and who they're actually hearing from. And there's no one solution here. We need to come at this from many angles. People need to hear it from multiple trusted sources. And that, for me, is a key part of any misinformation strategy, management strategy, but also any strategy that is based on building people's trust in vaccination. Over.
Thank you very much. So I have promised in the chat to Asli Kulane to have her ask her question. So if you would like to unmute Asli, I'm not sure if I'm pronouncing your name correctly. Introduce yourself and ask a question. Tell us to whom you're asking a question.
Thank you. My name is Asli Kulane, and I work with vaccine hesitancy and at Karolinska Institute. And my question is to Angus. Good to hear. It's an excellent session to all of you. And in follow up with what you were saying, the sources matter, Angus. And I think when we try to correct information by providing the right information from the right people, we are missing out the elephant in the room. And that is the healthcare providers who are providing YouTubes with deliberate disinformation. What are the consequences? How do we deal with those?
Hi, Asli. It's great to see you. So Lutz alluded to the fact that disinformation is coming from, it's deliberately engineered. We are now seeing it coming from state actors, and they are putting massive resources to this. And what they're doing is they're understanding more effectively than many of us in public health how to communicate to people and what matters to people. Of course, they can play the game with alarming, attention-grabbing information, but behind that, they play on themes, on levers, psychological levers that we know now are important. They've pivoted to liberty, which we know is a universal human value that correlates with people's decisions to vaccinate. They undermine the trusted messengers. So this is what Asli's just getting to. They know that they should be deliberately undermining the trusted messages because that is going to give their disinformation a better chance of getting traction. The answer to what do we do with a respected healthcare professional who's spreading disinformation is not an easy one, but someone in a quiet library who stands up and screams gets heard. If we had hundreds and thousands of health professionals on that whatever platform, in whatever conversation this is appearing, also speaking out calmly and quietly for vaccination, then perhaps that person would have less attention and less traction. Over.
Thank you. Adrienne, you want to answer that question?
Yeah, I just want to say something that we've also found in our research, which is not all health workers are created equal. I should say, like, there have been cases where healthcare workers were brought in to a region and they weren't from that region. And we actually found that they really lacked the credibility that was necessary in a way that could even exacerbate tensions or make it seem like there was a group coming from outside, you know, government appointed or INGO appointed group that's, you know, coming in to serve their own agenda. And so I really second what Angus says about local healthcare workers. In our research, there was a key difference between government and healthcare workers, like they're not actually perceived the same way. But the element of making sure that you're thinking about which workers, what languages do they speak, who are they, and how are they embedded in the communities where you're working is equally important, you know, consideration when you're thinking about that.
Thank you. Yeah, and we see that it's really important that you work with the local communities and you use the local languages as well, right? In order to be accepted. And that's also where it plays out with tension between different groups that may not be speaking the same languages, that may not be accessing the same media, and therefore may not be having access to the same level of information. Or sometimes in some settings, the official language is one language, but then some sub-communities or minorities will use the other language. So all these elements also play out in how people are going to be perceiving the information that comes from the government versus from civil society organizations that they're feeling close to. I have a question on Facebook from Malik Al-Kajawa. And that's a question for Lutz Guellner. So it says, looking at the principle of acting locally and connecting regionally, how do you evaluate this far the calibration between EEAS and the EU delegation's responsibilities and functions around the development of the COVID response strategic function and the national management of implementation of that strategy? Has there been specific country analysis where the EU has been able to identify its priorities in the different regions? So I don't know if you want to take that, please.
Well, I can take it. I'm not quite sure whether I can answer it because this is, of course, about the distribution strategies and goes much further depending on many other factors. But of course, I mean, for us, it is also always important if we deal with, let's say, disinformation, misinformation, also about our own activities here, you know, to be very clear and what we can do, what we cannot do in the EU, in the delegations, etc. So let me stay at that relatively general level here in terms of the communications. But I would like to come back to just one point that Angus has made. Or I don't know who mentioned it. It was a bit about do we have good communicators and bad communicators? You know, like the health workers are per se all good. No, I mean there might be also other people among the health workers that start kind of even intentional disinformation, maybe. And it will be very difficult for a government to set out some regulatory or even legislative activities, you know, to curb it or to put this in line. That's why I would see the role of governments, be it in crisis regions, be it in the EU, a very simple one, and that is identify very clearly when is the moment that people intentionally mislead people, you know, and that might be with the content. But I think it's even more important to look also how the content is being distributed, disseminated, and amplified, because we didn't speak about this. It sounds always a little bit technical and a little bit techy, but this is the stuff that really kind of tricks algorithms. This really puts you up in the search rankings, and this is where also the platforms still have a lot of work to do in terms of to prevent this, you know. And I'm talking about the things that are well known, like bots and whatever. But it's also much more subtle in the meantime. What we have seen in crisis-ridden kind of so-called poor parts of the world is that we see so-called news outlets that look like very reputable kind of news, let's call it operations, but they are fake from the very beginning to the end. They are part of a broader operation, either at a political level or with a very clear economic aim. And I think this is, if we define a bit kind of the minimum, what needs to be looked at, not only from a societal issue, etc., how to install trustworthiness and to restore and support maybe also kind of good quality journalism, it's also to curb these practices. And this is something that we have not only looked at, but that we are now starting. I'm just mentioning the Digital Services Act and other things that we have started to bring on the way, which might be very, very useful for inspiration also worldwide.
Thank you. Thank you very much. And I don't know, Angus, is this an old hand or is it, if it is a new hand, please unmute and speak.
Oh.
Okay, so I'd like to ask Adrienne, can you tell us a little bit about, you've identified these four determinants of trust and mistrust, but you mentioned that this report that Search for Common Ground has released is only, well, first I'd like to know where can we find this report is one question. The second is what happens next? Because I understand it's just the first of a series. What are you going to be doing about, measuring these determinants of trust? Do you want to talk a little bit about this? Because I feel, people are showing interest and we'd like to know whether there will be more research coming up.
Yes, so there will be more research is the short answer. The first round of research was conducted in September, and then we have another round happening now. And we'll have periodic rounds across these 6 countries over the next 9 months. So we'll actually kind of be looking not only at what are these factors of trust or what matters, but how it's evolving. Right now we have, an election taking place in Kenya. We've got quite a lot of evolution in the policy sphere around Yemen. There's quite a lot happening across these different countries, and so it'll be interesting to see how that's actually shaping the dynamics as we go forward. We've also made a few modifications. So going back to Cindy's question about do we actually break up, government for INGO versus NGO versus civil society, and the answer is we will be doing that in more detail. We already did some of the breakdowns in the first round of reports, but we'll do more of that because we want to be able to dive in to these questions a bit more with a bit more detail and understanding as time goes on. So we'll be using that for our media programming and to inform what are the key themes that we need to be thinking about, what's most relevant for people's lives that need to be brought into these conversations, and how is conflict really affecting our ability to create credible sources of information for people. So we're using this research to do that, and we'll be continuing to adapt our strategy based on the way that this evolves over time and the way that these divisions either do get better or don't in the coming months. The reports can be found on sscg.org/COVID-report. So I think someone will put that in the comments so that everyone can access them. And they'll be released, like I said, quarterly for the next few months. So others may be able to share their own thoughts on this, and we can hopefully have a better discussion as we use this. We'll also be sharing these on Connexus, what we mentioned earlier. And we want to be able to create a space where we're all sharing these resources together and understanding, how did we come up with our findings and how are they aligning to or differing from what other people are finding in their own contexts. So that's really, what we'll be doing with them over the coming year.
Thank you very much. I'd like to give the chance to any of our panelists, if there is any anything burning you would like to share that you wish you had said. It's your chance, because I'm going to close in 3 minutes. Shane.
Just quickly coming back to trust and trustworthiness, we had a fund from UNICEF to work in Gaza on risk comms for prevention of the spread of COVID. And a mechanism that really worked. It didn't matter who was doing it, whether it was an influencer, whether it was a mural on a school wall, or if it was information in health centres. It all had to be approved through the WHO, and also by default the Ministry of Health that was acting. So it didn't matter where that information was coming out. It kind of had that badge of trust associated to it. And I think that built very quickly the level of trustworthiness within Gaza, at least, because our reach became incredible, basically hundreds of thousands of people in a very, very short amount of time. And I think if those messages are standardized and they're checked, and the language is just altered slightly so that you can see, the language remains the same between different messages, even though it's coming in a different style or mode, then I think that worked very effectively. So I'd just like to share that with everybody.
Thank you very much, Shane, for this. And I've been trying to follow the chat, but really unsuccessfully. But I've seen a lot of resources being shared. So as I'm closing this session, I'd like to, well, first of all, thank so very much all of our participants and experts today for taking the time to share their wisdom with all of us and their research reports and findings. Also, all of the participants who've taken the time to ask very interesting questions. Apologies if I was not able to ask your question. But there is a forum on this Connexus platform where you can, there it is, where you can find and you can continue the conversation. So I encourage you to go there. You'll find all the resources there. And I want to thank as well the European Commission for co-hosting this event today and sponsoring this event today. So thanks to Hilde Hardeman for opening this event and enabling us have that very lively conversation. I promised a fascinating conversation. I hope it was up to your expectations. It was up to mine. Thanks so much for your active participation to this. Do connect with us at sfcg.org or on connexus.org. Thank you so very much to all of you for your time.